Hello everyone, my name is Kerstin Deniger. I'm Professor of Medical Informatics at the Bern University of Applied Sciences, and in the following minutes I would like to introduce my work on enriching clinical text embeddings by ontologic concepts. The motivation behind is that clinical documents bear important knowledge that is much more comprehensive than structured data like laboratory values, and this knowledge can be of relevance in prediction use cases and also for detecting clinical events. So for example, we could use clinical documents in conjunction with laboratory values and other structured data for making predictions on DELIA, for example, DELIA occurrence. Text embeddings, which are vector space representations, are increasingly used for text classification and prediction tasks. But we have the challenge that we only have limited textual resources in languages other than English. So text embeddings are learned from large volumes of text corpora, and these are unavailable for the clinical domain in German. Also, existing approaches often ignore semantic information that is often explicitly associated with the input data. In the medical domain, we are lucky to have a couple of medical ontologies like the Unified Medical Language System or SNOMED CT, but these resources are often not used when generating text embeddings. The ontologies provide, for example, concepts and semantic categories, which can be useful for classification tasks, for example. So the goal of my work was to run experiments that consider semantics in text embeddings and to assess whether the classification accuracy is changing, is improving by using this. There are some embedding approaches that use semantics from medical ontologies. So just to mention these three, there's BioBERT, where biomedical texts, which are PubMed abstracts and PMC full-text articles, are used to pre-train the embeddings after they have been trained on a general domain corpus. Then there is ClinicalBERT, which are domain-specific embeddings learned from data from the MIMIC3 datasets. And there's UMSBERT, which is an approach that is quite similar to what I have in mind. So they're using UMS concepts and map terms to concepts of the UMS so that words that have the same underlying meaning are connected or are mapped to the same concept. Also, the semantic group knowledge of the UMS is used in these UMSBERT embeddings. However, BioBERT and ClinicalBERT, as I mentioned, are trained on English documents, so we are still missing approaches for German language. In this work, I'm focusing on a use case that is based on German clinical data. So the particular use case I'm considering or I have in mind is that I would like to evaluate the post-operative risk of readmission for obese patients after surgical treatment using only the discharge summaries, so the documents that are generated when patients are interrogated after the surgery. So they are coming every 6 months, they're coming after surgery, they come back, and the physicians are assessing specific aspects of health, physical health, but also mental health, and these items should be used to assess a post-operative risk. So I have available de-identified outpatient clinical notes from patients with obesity. In particular, there were 33 patients available and their related outpatient notes, which are 305. The dataset was collected in a time range of 3 years, and we have clinical and non-clinical categories. They are shown actually here in the yellow box. So for example, One category is considering the intake of multivitamins by the patient, which can be regular or irregular. Or another category concerns complaints, which might be complaints with food intake. There might be no complaints, there might be somatic complaints or psychological complaints. So all in all, we have 22 categories and 604 sentences falling in one of these categories. So this is a data set. The approach for enrichment is as follows. On the one hand, I have the embedding that only relies upon the raw sentence, so it's a simple back-of-word approach to generate this word embedding. And on the other hand, I'm using a natural language processing pipeline that maps the raw sentence to concepts of a biomedical ontology, and in this way enrich the sentence with knowledge from the ontology. Both vectors are then merged, and the resulting vector is content enriched. So this is the basic idea. Just a few words for this concept mapping. I'm using a commercial tool which is called IDMax, and this is based on the Wingert nomenclature. The Wingert nomenclature is a derivative of the German translation of SNOMED 2. So it has the same roots as SNOMED CT, and it is organized as an ontology. So we have concepts, and each concept is assigned to one out of 10 semantic categories. For example, we have hospital admission as procedure, for example. And the ontology also has relations between the concepts that we know, for example, which disease occurs on which topology, or we have also part of and is a relations. And this, of course, is knowledge that could be very useful in embeddings. And this is actually the basic idea I have in mind, also to use these relations in enriching content of clinical documents. The natural language processing pipeline is based on a morphological analysis of words. So words are analyzed and then mapped to concepts of the ontology. I run 2 experiments. The first one aimed at identifying suitable feature sets. So I assess different feature sets, enriched and non-enriched, and different combinations of features, and assess the classification accuracy. For sentence classification, I used the fast text supervised algorithm, and I did 2 types of experiments. The first one, I used fixed hyperparameters, and then a second set of experiments, I rewrite hyperparameters and only considered 3 feature sets. This experiment was conducted on all 604 sentences and over the 22 categories. Here you can see the results. I am showing the precision at 1 value. The recall at 1 value was the same, so it's not shown here. And you can see the different feature sets I considered. So the first one is the simple back-of-word approach. Then we have only the concept terms, only the semantic categories. So as I mentioned, each concept term belongs to one semantic category. And here I only use the categories. And then I use different combinations of these basic features. The results are not that much convincing. We can see that when using concept terms plus sentences, so enriching the sentence with concept terms, it performs best considering these different feature sets. Then for the second part of the experiment, where we write hyperparameters, it can be seen then when we are using more epochs and dimensions, the accuracy increases. And here again we can recognize that it's better using either the concept terms or concept terms plus sentences than just using the raw sentence. The second experiment assessed the sentence classification in a two-class classification problem. So here I used a deep neural network as model for sentence classification. Two-class classification problem means that for each of our 22 categories I mentioned at the beginning, we considered the sentences labeled with a specific category. So for example, multivitamin intake regular as positive examples and all other sentences as negative examples. This results in a very imbalanced data set. So for this example with multivitamin intake regular, we had 44 positive examples and only 560 negative samples. In order to have enough enough positive examples, we considered only categories where we had at least 14 sentences as positive examples. The model, so the deep neural network, consisted of an embedding layer as the first layer, then followed by two bidirectional LSTM layers, a dense layer, and a final output layer. We used pre-trained GLOVE embeddings that were trained on German Wikipedia data and, well, our data set then for classification. Here you can see the results for the different categories. You can see that sometimes, so for these two cases, for these two categories, the embeddings, when we only use sentences, achieved better accuracy. So here you can see accuracy values, while for other categories, the enriched sentence performed better, led to better classification results. This leads me to the conclusion that enriching sentences with concept terms has potential to improve the classification accuracy, but these experiments I conducted here are very preliminary, so a much more systematic assessment is required to really confirm these results. I also have to conduct an error analysis to see why for particular categories the raw sentence is better suited than the enriched sentence. The work has a limitation that we used pre-trained embeddings trained on Wikipedia, German Wikipedia. So here, of course, clinical text would be better, but as I mentioned at the beginning, we still don't have such a huge data set that can be used to train embeddings. And also a much more balanced data set would be useful for assessing classification accuracy. With these words, I'd like to thank you for your attention and feel free to contact me if you have any questions or comments.